Hi everyone, welcome to my YouTube channel My Health and Me byfun. Please like, subscribe and share. Incontinence, the involuntary loss of bladder or bowel control. While it is more prevalent in older adults, particularly women, it can affect anyone. Many people feel embarrassed or ashamed about experiencing incontinence. This can prevent them from seeking help. Remember, it is a medical condition, not a personal failing. Do not let embarrassment keep you from getting the help you need. Incontinence primarily manifests in two forms: urinary and fecal incontinence. While both involve a loss of control, they affect different bodily functions and have distinct causes and treatments. Urinary incontinence, as the name suggests, involves the accidental leakage of urine. This can range from occasional dribbling to a complete inability to hold urine. It is particularly common in women, especially after childbirth or during menopause, due to changes in pelvic floor muscles. Fecal incontinence is the involuntary loss of stool or gas. This can be deeply distressing and often leads to social isolation due to embarrassment. Conditions like diarrhea, constipation, and nerve damage are often associated with fecal incontinence. Urinary incontinence is not a one-size-fits-all condition. It encompasses several subtypes, each with its own set of triggers and characteristics. Stress incontinence is the most common type, often triggered by pressure on the bladder during activities like coughing, sneezing, laughing, or exercising. Weak pelvic floor muscles are a major contributor to stress incontinence. Urge incontinence is characterized by a sudden and intense urge to urinate, often followed by leakage. Urge incontinence is linked to overactive bladder muscles. Overflow. Incontinence involves frequent or constant dribbling of urine due to an inability to completely empty the bladder. Causes include blockages in the urinary tract, nerve damage, and certain medications. Functional incontinence occurs when a physical or mental impairment prevents you from reaching the toilet in time. Mixed incontinence, as the name implies, this involves a combination of two or more types of urinary incontinence. Fecal incontinence, while less common than urinary incontinence, can be equally distressing. It is often associated with underlying medical conditions, lifestyle factors, and even psychological stress. Muscle damage or nerve damage in the rectum, often due to childbirth, surgery, or conditions like diabetes, can lead to fecal incontinence. Conditions like diarrhea and constipation can exacerbate symptoms, making bowel control more challenging. Certain risk factors can increase your likelihood of developing fecal incontinence. These include age. Older adults are more susceptible due to age-related muscle weakening. Women are at a higher risk, particularly after childbirth. Chronic conditions such as diabetes, stroke, and multiple sclerosis can contribute to nerve damage. Obesity adds pressure on the pelvic floor muscles, thereby increasing the risk. While urinary and fecal incontinence are distinct conditions, they often share common risk factors and underlying causes. Age is a significant factor for both types of incontinence. As we age, muscles naturally weaken, including those responsible for bladder and bowel control. Chronic conditions like diabetes, stroke, and multiple sclerosis can affect nerve function, impacting both bladder and bowel control. Obesity puts added pressure on the pelvic floor muscles, increasing the risk of both urinary and fecal incontinence. Lifestyle factors like smoking, high caffeine intake, and a sedentary lifestyle can also contribute to both conditions. By addressing these shared risk factors, you can take proactive steps towards preventing and managing incontinence. If you are experiencing symptoms of incontinence, your doctor will likely start with a detailed medical history, asking about your symptoms, lifestyle, and any pre-existing conditions. A physical exam, including a pelvic exam for women, helps assess muscle strength and identify any abnormalities. Keeping a bladder diary where you track your fluid intake, urination frequency, and instances of leakage can provide valuable insights for your doctor. Based on your symptoms and medical history, your doctor may recommend further tests like urine tests, bladder function tests, or imaging scans to pinpoint the cause and type of incontinence. Treatment depends on the type and severity of your incontinence. Lifestyle changes often form the first line of defense. Bladder training involves scheduling bathroom breaks. Avoiding bladder irritants like caffeine can help. Pelvic floor exercises or Kegels strengthen bladder muscles. Medications may be prescribed to improve bladder control. For severe cases, medical procedures or surgery might be recommended. Living with incontinence can be challenging, and while not all types of incontinence are preventable, you can take proactive steps to reduce your risk and maintain bladder and bowel health. Stay prepared. Keep extra underwear, pads, or protective garments handy for peace of mind. When going out, map out restrooms in advance and choose clothing that is easy to remove quickly. Use barrier creams to prevent skin irritation from frequent moisture. Do not restrict fluids out of fear of leakage. Dehydration can actually worsen symptoms. Practice Kegels regularly. It helps strengthen pelvic floor muscles, responsible for bladder and bowel control. Maintain a healthy weight. Losing even a small amount of weight can significantly reduce pressure on the pelvic floor. Eat a balanced diet. A fiber-rich diet promotes healthy digestion and prevents constipation, a common trigger for fecal incontinence. Regular physical activity keeps your pelvic floor muscles toned and improves overall health. Smoking weakens pelvic floor muscles and increases the risk of both urinary and fecal incontinence. Quit smoking. Remember, prevention is always better than cure. Living with incontinence can feel isolating, but remember, incontinence is often treatable. Do not let embarrassment or shame prevent you from seeking help. Talking to your doctor is the first step towards diagnosis, treatment, and regaining control of your life. Thanks for watching.